What's up, people? It is Thursday at 3:30, almost 3:24 p.m. Mountain Standard Time. Here I am, live. I didn't tell anybody I was coming live. I told you guys on Tuesday, actually. I was going to do another one on Thursday, but I didn't tell what time it was. I was supposed to do a private group chat with some folks that are in my secret circle, inner circle. I don't really call it that. I'm kidding. But we had some technical errors and our difficulty, so I decided to do this live instead. Anyway, so let me get, hold on, I'll figure this out. I have to pull up the chat on my phone, so I got to pull up the YouTube on my phone so I can see your chats here and my channel, and there we are. All right, now I gotta find the chat. Hold on, top chat. Bada bing. All right, cool. What's up, Lizzie White? How's life? It's good. It's not bad. Sandy or Karen Deep. Yeah, I thought I emailed you back, didn't I? Is all the school worth it to be a doctor? I don't know. It certainly sucks. It's a lot of work. But you get to do some things that nobody else gets to do. You get to do something with your life that's fairly significant. Let's put it that way. Depends who you're helping. What do I think about anesthesia residency? It's hard too. But anesthesia is a good discipline if you like that. I think it's good. My email is drbuckparker@gmail.com. Any advice for high schoolers who want to be a surgeon? Yes, play video games, a lot of them. And then when you're like a junior in high school, you need to start figuring out how to study like a couple hours a day. And if you can do that in high school, which is a real pain in the butt, at least 1 hour, maybe 2 hours a day, then by the time you get to college, you'll have that down. It'll be like ingrained in you, and college will be easy. How are my new shoes? I haven't tried them on yet. I got these on today. Can you see those? I got the blue ones. Got my socks on. Those are pretty sweet. One of my favorite organ systems. Actually, I liked cardiac. That was pretty fun. But I don't know. I probably should have went to cardiac surgery, but I was too fucking lazy to do like 2 more years of fellowship. I was already 35, and I was like, I gotta get out of here. I'm gonna fucking kill myself. Speaking of, everybody's talking about that right recently. How well did I do on step 1? I got it at a 220. At the time, that was a 90th percentile. Some cardiologists say that cholesterol is not associated with heart disease. Have you heard about that? So really what heart disease is probably inflammation and not so much the cholesterol or the fats, but it's really inflammatory process inside the lumen of the vessel, and the inflammatory process then makes the cholesterol stick there. And why do they have inflammatory process, which is the question? And many people think it's simple carbohydrates or sugars, which I do as well. I think that's the number one problem with our health, no question, is soda. Like that's where everybody gets their simple sugars from. And it's just like a massive amount. It's like ridiculous. And everyone just thinks it's okay to drink fucking soda, sugar water all the time. It's stupid. Stupidest fucking thing. How much do I study and practice? Like how much do I have to look things up? I mean, it gets less over time, when you don't know things. Because as you over time in your practice, you see things repeatedly, and you do have stuff that is, sorry, I'm just adjusting. You do have things that pop up that are, you don't know what they are, but it's like probably like 80% of the stuff you see is recurrent, or the same stuff, and then like 20% is like it's abnormal, maybe an abnormal presentation of something that you have seen before, or yeah, stuff like that, or completely new, or something you don't see very often that you have maybe researched before or you've read about before, something like that. Can we get more car driving motivational videos? Yes. So I shot like 3 videos this last couple of weeks, but what happened is I have these guys that edit the videos, and they are on vacation this week, and so they're not editing anything. Plus I had all the videos that I did for my study course, and so they like worked double time for like 2 or 3 weeks, and then they were on vacation. So I said I'm going to do lives this week for a couple weeks, and then we'll start back with the regular videos like next week. I think next week. You're a little crazy and you need adrenaline rush every day, tossing between emergency medicine and trauma surgery. Well, if you want to have an easy life and make a pretty good amount of money, but know a little bit about a lot of things, then you go into emergency medicine. And if you want to be like a real badass, and you want to know a lot about a little, not a lot about a little, but more focused, and you want to do some really badass shit, then you go into trauma surgery. But it's a tough life. Did different medical schools teach different things? Not really. No, Ivy Leagues are better because of the connections. And for the rest of your life, if you say you go to Harvard, like doors just fucking fly open for you. It's like being a celebrity, essentially. Like you walk into a restaurant, like, oh, Brad Pitt, like you can have any table, like they'll kick somebody else out, right? So if you go to Harvard, that's how they treat you. Harvard, Yale, Stanford. You say like, oh, I went to med school at Harvard. Everyone's like, oh, let me fucking give you a fucking hand job. It's dumb, but that's just the way our life is. Do you know anyone else who's done military medicine? I know a few people that have done military medicine, and I'm back and forth about that because the trauma surgery people in the military, like some of them, it's hard to say because some of them act like they really get all this fucking experience, and then I talk to other people who say they don't get a lot of experience as compared to like if you go to, South Central Los Angeles, inner city Chicago, Detroit, stuff like that. I mean, we were seeing like gunshot wounds and stabbings and stuff like on a fucking daily basis, like multiple times a day. And some of the military guys, like they go out and they won't see anything for a long time, 6 patients at once or something like that, or, so this is what I've heard. I don't have firsthand experience. So, and they consider somebody like a veteran of trauma surgery when they've had like 4 patients, and we'll have, like I had 4 fucking gunshot wounds in a day. I had 6 gunshot wounds at one time in Detroit. It's like, this 4 is nothing. Fourth year medical student in France, do you think it's worth to go study for a year in the States? You love France. That depends on where you want to live and practice. If you want to live and practice in the United States, then yes. If you want to live in France, then no, you don't need to do that. Do I think accountants can earn more than doctors? If you own your own firm, accounting firm, and like you have a bunch of accountants working for you, then yes. But that also takes a long time. You're not going to get out of accounting school and then all of a sudden, like, start your own firm up. You have to work for somebody else. You have to learn the ropes. You have to be really good, experienced 10, 15 years it's going to take you. And then you're like, okay, I know the ropes. I know how this shit works. Now I can open and practice with and hire other people. When am I planning to go live on Instagram? I might do it tonight. I was thinking about actually doing it tonight if I don't have anything going on. I went out with, hung out with this girl that played Survivor like twice last night. I was gonna do it last night, but she wanted to hang out, so we just went, like, had a drink and went to dinner. Can I still get a med school if I transfer from a community college to a four-year university, assuming I'm still a student? Yes, I think so. I didn't do that, and I didn't go to community college, but I think if you transfer 2 years in, you go to university, you finish, you do really, really well, and then you do good on the MCAT, I think that is a reasonable thing to do. I'm assuming you're talking about a U.S. school as well. What other specialties was I considering? I was actually planning to go into plastics. Like my entire life, because I was like an artist and I liked surgery, and I was like, plastic surgery is for me. I just wasn't very impressed with it when I did it in residency. I really liked neurology, honestly, like just neuroscience in general, but it was too medicine for me, and I didn't really, honestly, I didn't think I had a chance to get neurosurgery, so I didn't really think about that. Dude, do you think it's truly necessary for med students to take so many tests, and plus why are doctors working long hours, on, especially that doctor has an important job? There's much more in medicine than I think most people realize, and you really have to have a broad background in this stuff. I mean, there are a few classes in med school that I think you maybe don't need, but pretty much all of it, you're like, I fucking need this. And there's just so much to learn. It's ridiculous. You get out of med school and you still don't know shit. You don't know anything. You get out of med school. You get a fucking residency and you're still fucking green. That's 9 years. It's a lot of shit in medicine. Oh, there you go. Jackie Marie Bear she started in community college, transferred to 4-year, just accepted in med school. Way to go, Jackie. Good job. I'm proud of you. What would I say to someone who wants to be a neurosurgeon? I would first ask you why you want to be a neurosurgeon. How old are you? Why do you want to be a neurosurgeon? What is your motivation? What kind of personalities do you think will thrive in trauma surgery? Second year med student considering elective to take. Type A people, fairly aggressive people. I'm actually not that aggressive of a person in general, but you kind of have to be a little bit of aggressive in that. Stupid. I go to a newer med school in Michigan. How can I maximize my chance of going to residency at some place like a U of M? I don't know, man. Like that's a fucking Ivy League, consider basically you're gonna have to know somebody. Unless you go to a really great undergrad. Do I believe in mentorship? Yeah, it's essential for surgery. It's essential for life. If you want to excel, you have to have some kind of a mentor. What happens if you're from another country and you want to attend a U.S. med school? Then the best way to do that is to do your rotations, like your third and fourth rotations in the United States, and get to know people there and get to know the residents and the programs, and try to get one program that you really try to get lots of rotations at one program, so you start to know everybody there and you just do an amazing job. that's the best way to do it. It's really tough to just show up and apply when you've never been in the States and you don't know anybody. Does having a resident guarantee you a job after you pass your boards? You should, a residency, I'm guessing. I guess. I mean, I don't know if anybody's not got a residency after. I mean, not got a job after they pass your boards. You know, you could be a real dick, and no one wants to hire you. That's for sure. But do I like the idea of a high school student shadowing doctors? Oh, I got a phone call on. Dr. Parker. Yeah. Oh, okay. You're done at 6. Okay, let me call you at 5 and see where I'm at. Okay, alrighty. Yeah, thanks. Okay, bye. You guys saw my car? I'm getting the wheels blacked out on it. It's gonna be fucking sick. Anything I regret about being a surgeon, like spending less time with your family or missing out on certain holidays? Yeah, I mean, yes, you miss out on holidays, you miss out on people's time, but you know, it's a trade-off. You know, there's not a lot of people that know how to remove organs safely from other humans, so you know, it's tough. It's a tough thing, but the other thing you have to think about is when you're 40 or 50. You know, if you don't do those things and you don't make those sacrifices, what's going to happen? Are you going to be regretting that you didn't make that sacrifice when you could, because you can't go back in time? Do I think every medical specialty has truly their own Myers-Briggs person? Nah, not really. I mean, I did that a couple videos just for fun, but you want to see people that have brain issues? Sorry, I need some coffee. Oh, yeah, I mean, it's okay if you want to be a neurosurgeon. Like, that's fine. It's just it's a hard road. Number 1, it's a hard road. Number 2, it never stops. It's really a difficult job after you're done too. I mean, my job is done difficult, but man, I get breaks. I don't work as much as neurosurgeons. Maybe some general surgeons do, but they're fucking stupid. Like, some guys work so much and can't make ends meet and all that stuff. Like, that's just bad, like, planning or whatever. Let's see. Oh, not a question, but I'd like to thank you for your videos. Inspiring and really helpful. Awesome. You're welcome. What do I think about vascular surgery? I think it's technically kind of fun. It's cool surgery. The patients are really difficult to deal with because mostly they're old and vascular paths, which mean they have lots of medical problems. And it's like a continual, like, the classic is fem, pop, chop, chop, because you just like keep operating on them. They keep having more problems, and pretty soon you have to chop their legs off because you can't fix it anymore. Like, it's not obviously always like that, but it does happen. Why do I trash on plastic surgery in my videos? Cause, man, it's fucking called sarcasm. I mean, it's just for fun. I like to fuck with them because this is why I like to fuck with plastic surgery, because they get a lot of money, okay, and they walk around like pretty fucking arrogant, but the surgery is like not complicated. It's not complex. It's kind of almost like it's like easy surgery. You know what I'm saying? So that's why it's a kind of bust their balls a little bit. Like a transplant, I'm not gonna bust a transplant surgeon's balls because it's fucking hard surgery, and they work their ass off. The plastic surgeons work their ass off too, but they get paid like, you know, in unproportional to their work. Like, you're a psychiatrist with a fucking scalpel. Like, it's not necessary. You're not saving lives. You know. Puerto Rico, what's up? What should be the best thing to gain from pre-med summer internships? Relationships. You definitely want to make relationships. You want to understand also what that person is doing. Like, because you never really know for sure it's hard to understand what people are doing, like what their life is like. If you like, I want to be a neurosurgeon, you don't know what that guy does every day. You're like, oh yeah, I like the brain, but what do they do every day? Like, what's their life like? So that's something you want to try and figure out. Because you're gonna, if you're gonna do it, then that's gonna be your life. And the surgery is not only, being a surgeon is not only about what you're doing, but how you're living your life too. So you want to get an idea. Saudi Arabia. What advice do you give a high school student? So these two things: play video games, and learn how to study 2 hours a day by your junior year. Orthodontists are pretty arrogant. Yeah, because the arrogance comes with the money. And if you make a lot of money for not doing a lot, then you'll be like super arrogant and you'll think you're better than everybody else. I mean, not everybody does that, obviously, but that's kind of where it happens. Do you see any arrogant fucking family practice doctors? No. Very few. Johns Hopkins General Surgery residency is the FMG. So there is a guy from Nigeria who is a general surgeon at Johns Hopkins right now. I think it's right now, or he finished it. So it's not impossible, but you're gonna have to know somebody or get some kind of scholarship there. Is cardiothoracic surgery worth it? So I think cardiothoracic surgery is. I know they're having a tough time right now. Like some of the residents and the fellows like are having a tough time getting jobs. Like you're not gonna. The only thing about cardiothoracic surgery and neurosurgery and even general surgery, like I thought, oh, I'm gonna go be a general surgeon and then go back to my hometown and work. It just doesn't work like that. Like the more specialized you are, almost the less choices you have as far as your location where you want to live. And that's a big fucking deal. Like if you don't like the snow and you cannot get a job in southern part of the United States and you're stuck in Maine, you might be fucking miserable. Why the video games? If you're going to be a surgeon, you need hand-eye coordination. So that's like, I think it's the easiest way to get to improve your hand-eye coordination. Plus, there's some research data to say that surgeons who previous or currently play more than 3 hours of video games a day make significantly less errors in the operating room, and their operations are faster. And I happened to play a lot of video games when I was younger, and I also saw that when I started operating, especially laparoscopic surgery, I was like fucking 10 times better than everybody. And not because I'm just like bragging, but they actually told me, the people that I started operating with were teaching me laparoscopic surgery were like, you're fucking 10 times better than everybody else. But I know for sure it wasn't because of anything, but because I played video games like a motherfucker. I played sometimes for like 14, 15 hours a day when I was younger. So I attribute all of that to the video games. How can your med school loans be forgiven by the government? I don't know. If you find out, let me know. Is pediatric better than a general surgery? It depends on what you want to do. Pediatric surgery is very hard to get into. It's actually probably about 3 years on top of general surgery. Most people have to do a research fellowship. Some people do 1 year, some people do 2 years, some people do 3 years of research in order to get into pediatrics and then don't get into pediatrics. I know somebody that did that. Other people do 2 years of fellowship or research and then get a pediatric fellowship, which is 2 years, or maybe 3, I can't remember, after general surgery, which is 5. So that's a 5 plus a 2 plus a 3. That's a 10. That's a lot. What was the last surgery I did? I just did an appendectomy yesterday afternoon. I got a laparoscopic lysis of adhesions coming up here in about half an hour. Step 1 advice. You know, I think that like the study habits thing is really big for me because like if you can't sit there and study for long periods of time, then you're not going to be able to do any of this. But I guess if you're step 1, then you're in med school already, and hopefully you're doing well. If you're a first year med student, or you're going into first year next coming up, then I would say, you know, get the step 1 books now, and then kind of cross reference what you see in class and what's on the step 1 books in the books. That way, you have an idea what's most important. What kind of watch is this? This is the Omega Speedmaster. First watch on the moon. Shout out to the Scottish fans, Mark Walton. You're an orthopod in oh wait. Oh, I don't know. Why is it Stephen somebody asking me to shout out to Mark Walton? I don't know. Anyway. Should you stay and watch the Q&A or go study? Well, depends on how far behind you are. How important are grades in med school? So you have to have a good step 1 score, and then second, I would say your grades. You have to have good grades. If you don't have a good step 1 score, your grades are not going to say, well, grades will help you if you're a US student. It won't save you if you are a Korean student. My dream car, I think it's the Ford GT. Have you seen that thing? They've just made a new one too. It's fucking crazy. I think it's the old one though. There's like, it was built in like 2007 or 6 maybe. That one's sick. Opinion of Ross. So I think Ross is good because the students that I met there were really smart, but it's very hard. Can I do a video like Dr. Mike, or watch House and explain how medically accurate it is? I think would be hit. All right, I will do that. You guys keep asking me to do that, and I feel kind of stupid because like there's like Dr. Mike does it, and then there's like a couple other doctors jumping on the fucking bandwagon, even though like I know more than them. I'm 100% positive of that because I have more experience. But what's your Maria? You asked like 4 questions. I answered like 4 or 5 questions already. You don't get the Ford, huh? Busted on the Ford. It's a fucking supercar though, man. And it's not like a Ford fucking Taurus here. We're talking about a GT. I am not married. It's views. You're just saying it's views. That's a good point. Maybe I should just do it for that. Favorite medical TV show? I did watch Grey's Anatomy for a while, and they had some good stuff. Like the first couple seasons, I watched a few episodes, and they were pretty good. I haven't watched it in like, I don't know, fucking 5 years, probably more. Does general surgery in the States mean only abdominal operations? Because in New York, my country, there is specific specialty in abdominal surgery. We do soft tissue. So general surgery can incorporate breast, soft tissue, mostly abdomen. Some guys do, amputations. I do some amputations, and we do trauma. So some general surgeons do thoracic surgery as well. Just depends. Mostly like esophageal and some minor chest surgery, pulmonary resections and stuff like that, like thoracoscopic. I was about to, and then I got a phone call. What is it? You gave me $2 to get a Ferrari. I don't want a Ferrari. I'll tell you guys a funny story though. So this guy that I know, he's like 80-something years old, and he collects Ferraris. He used to be the CFO for like GE or some shit like that for like 25 years, and he's got a bunch of fucking cars. So I go over his house one time. This is like 4 or 5 years ago, and he goes to show me his Ferrari collection, and he has this F40 or maybe it's F50. Look that car up. It's fucking expensive, right? And so he is showing me, and he's Italian. He's got this like thick Italian accent. It's like, he's like, yes, this, that, but, and then he looks, and then in the wheel well is a rag in there, and he just had it serviced, and he's like, what the fuck? These fucking stupid, dumb fucking mechanics, they will fucking burn my car down, blah, blah, blah. So he picks up the back, like the engine's in the back, and so he picks up the hood of the thing, and he goes to reach in, and he's like, hey, hold this up for me. I'm like, okay. So I hold it like this, and then he goes to like get in more, and so I push it up like that, and it hits the top. It's the fucking garage on the top. it's like a $500,000 or $600,000 car, and I just smashed the thing on the top of the garage. I about shit myself, and then I was like, oh my god, please no marks, please no marks, please no marks. And so then I brought it down. I looked, and it was like barely scuffed a little bit. And it's all fiberglass, so there's no paint, come off or whatever. Oh man, it was bad. I thought I was gonna have to buy a fucking $10,000 wing. It's like Jesus. 1 million or the best surgeon ever. Be the best surgeon ever, because if you're the best surgeon ever, you can get way more than $1 million. Plus $1 million is really not that much money. It's not gonna last you long. I guess spend $1 million in like 6 months pretty easy. Should you take your prereqs at a community college or a university? I would say university. How much of pre-med is actually applicable in the field? Not very much. You're only 16 and a half and want your life together now and don't end up hating my life. That's it's good. You should. Orthopedics matches an FMG based on strength of application. You can. You have to get a very high score on the USMLE to do that, but you can do it. It's. I know people have done it. How much debt did I come out of med school with? About $300,000. Can you give tips on how to learn anatomy? It's just repetition for me. I did lots of flashcards. Will I start watching doctor TV shows and review them like Dr. Mike? Yes. Okay, fine. That's like the second time. That's like the fourth time I've been asked. If you're good at memorization, will you be good at med school? Yeah, probably. I mean, medical school is like actually putting things together too. It's not just memorization. So, but that's one part of it for sure. It helps a lot. Can doctors change their specialty later in their career? You have to go back to residency and do another residency, which is a difficult thing to do. Banzo in the emergency room ghost story. Is this Aisha? This is not my Aisha. Yeah, that was a good story. Fucking Banzo was crazy. Do you think it's fine to have a job in med school? No, it's impossible. You can't have a job in med school. You're studying fucking 14, 16 hours a day. Yeah, so I'll do this. I'll review the TV show about Dr. Mike. Can you learn? You're 15. Can you start learning human anatomy now? Yeah, of course. Why not? There's a you go biodigital.com. It's a digital cadaver. It's pretty awesome. Check it out. Year 10 high school student who wants to become a doctor. Yes. Um, learn how to get learn how to study 2 hours a day while you're in high school. If you can do that, you're gonna crush, and you do it over a long period of time, couple years. When you get into college, you're gonna do amazing. Starting med school at 30, you want to do family or ER? No, it's fine. It's not too long. You'll be done before you're 40. Oh, here's my case, Dr. Parker. Hi, I am. I'm pretty sure he's pretty close. So what's up? What are we thinking? So like 45. Okay, that'll work. Yeah. Okay. It's in my office, so I'll be here. I'll call him and let him know. Thanks. Half an hour, 45 minutes. I got a case. I have to email, text message my partner. All right. So I missed a bunch of stuff here, but I should do a reaction on TV. Oh, that I do a live one and watch TV. Okay, I get it. Do that. I'll do that for another video. I'll do it live though. That's how I talk to the OR staff because they're cute girls. Uh, Ferrari's better. Italian student wants to come to the U.S. for residency. Yeah, start early. Start like as soon as you can, getting over here. The more you have here, the better. What's the most difficult operation situation you've been in? Did it end well? I had lots of bad situations, and which did not end well. I had lots of bad situations that did end well. I've had really bad gunshot wounds that die. I've had been in cardiac surgeries that die. I've had young kids that die. I've had, um, I had a 15-year-old kid in Detroit shoot a 17-year-old kid in the head, like right here. They brought him in, but he was still alive because his heart and he's still breathing and heart was still working and stuff like that. And you can't do anything. Kid's dead. So he was an organ donor, I think, and I had another kid like get shot cardiac like right here, and it flew through his eyeball like that and in through his mouth. And then went over there and landed in the neck, and he came in actually walking and stuff, and we ended up, me and the neurosurgeon saved him, so it was good. Doctors marrying doctors, I think it's good because you guys understand each other and how much shit you go through. How hard is the transition from M4 to intern year? Try putting a watermelon up your ass. That's that hard. Did I pick up the asshole trait from my attendings? Yeah. Let's see. Okay, I'm probably gonna have to end this actually because I gotta go. But thank you guys once again for chilling out with me, and then maybe tonight you guys want to do Instagram Live? What are you talking about? I'm not gonna gun anybody down, man. You guys are crazy. All right. Thank you guys so much once again. I'll see you maybe tonight on Instagram Live. We'll have I have the dog over, so we'll do a hanky. And anyway. You guys are fucking funny. Hey, if you want to learn how to study and be a badass doctor like me, go to secretstudyhacks.com. Go check out my program. It's teaches you how to study for a long period of time, be motivated, stay concentrated, all that stuff. So it's been getting really good reviews so far. If you're like a high school or college student that's having a tough time, that's really what it's for. If you're a resident or a med student and you're already studying for a really long time, it's really not probably for you. But even if you're in high school and college and you want to go into nursing, or pharmacy school, whatever, it's just really for people that's had a tough time studying thus far. And so I kind of fix some problems that I see most people have. So go check that out. And it's super cheap, so you should get it. And then I'll be your mentor as well. All right. All right, you guys. Take care. I'll see you next one.